Welcome to Tapping Wisdom. I'm Sue Padernacht, and I'm so delighted to introduce you to Dr. Felix Aguilar, who is the Chief Medical Officer at CSC Health, which provides healthcare services in 6 locations throughout Los Angeles to the underserved community. We've known each other actually for many years. We were both on the board and did volunteer work at the American Cancer Society for quite a number of years. And so I invited Dr. Aguilar to join us to talk about his experience, his 2020-2021 experience as the Chief Medical Officer of a very important healthcare service provider within Los Angeles. You know, what his leadership practices were in terms of the organization itself, patients, employees. And I'd like to end, Felix, with talking about yourself and your own resilience and how you sustained through all of this. So with that, I want to just tell my anteater friends from UC Irvine that Dr. Aguilar went to medical school at UC Irvine Medical, and he also got his MBA at Harvard University. So with that, thank you so much for honoring us with your wisdom. Felix, would you tell us a bit more about yourself and how this past year has gone for you?
What a year, right? 2020. It was a tremendous year, a tremendous change. I was just talking to my board that it was, I call it a pressure cooker that forced change onto us that, however it might have been coming, it really made us change in ways that really moved us forward in different ways. And one of my own mantras has been regarding change and how do we manage change, has been be flexible, pivot, and reassess. So regarding being flexible, back in March 19th, I remember exactly that Wednesday when the stay-at-home orders came from the governor, and suddenly all our patients needed to stay home. Our employees, half of our employees, we have to mandate to stay home because they're not required to come to the clinic, and our patients needed to stay home. And you know, patients who have diabetes, who have high blood pressure, who had COVID, and we needed to be flexible. And we have never done telemedicine, and at that moment, suddenly we had to adapt. We needed to pivot to start providing care through telephone, through video calls. And in a matter of weeks, we instituted new protocols and definitely culture change because our staff had never done this. And also, of course, we never stopped seeing patients in the clinic. Never stopped seeing patients, because even though I say that most of our visits were telemedicine, so that was about 70%. We still had some patients that needed to come in. So we needed to institute new protocols regarding using PPE. You may remember back then that even that became a big deal, trying to get gloves, masks, face shields, the whole covering for your body, and creating new protocols. And that created a lot of distress among our staff. So that's what I mean about reassessing. You know, we had to continually be reassessing what we were doing, and continue to be flexible and continue to pivoting as we move forward on this. A lot of our staff was very concerned, even as medical professionals. They were concerned, am I going to bring COVID to my house, to my family?
Yeah.
I am committed to my patients, but am I putting my own family. Maybe they were willing to give their lives for others, but are they willing to sacrifice their kids, their loved ones? That is a bigger question. You know, maybe I have, as a medical doctor, I said, okay, I willing to sacrifice my life for my patients, but am I willing to sacrifice my kids?
Right.
That's a bigger question. And so, you know, to say it to one of my doctors, okay, and so what we did is we instituted very strict precautions. You know, how do we handle patients when they come in? How do we handle our PPEs, our usage? And really, for the first 6 months, we had no cases. Nobody in our staff got sick.
Wow.
Yes,
The
no
first 6
one.
months, so March
March,
through the
basically
fall
through September.
to September.
Nobody, because we're
Wow.
really good about. Now, eventually the numbers, and probably people got infected outside of the clinic. It's been, you know, the number, it became overwhelming, but we got one doctor later on who did get sick. But even then, we were very good about controlling that, and we never had like a major group of staff getting sick.
How is that doctor? Did that doctor recover?
Yeah, she did recover. She
recovered?
was in UCLA. But what I'm trying to say is that it really pushed us to the limit. There were days that I went home thinking, oh my God, how am I going to do this again? Long days, 10-hour days, 12-hour days that I was like, because we were doing our regular work, we were seeing our regular patients, plus COVID. COVID work, meaning what I mean is, yes, patients with COVID, but testing, doing all the other stuff we were doing. So it really pushed us. So how do we do it? It's over communicating.
Over communicating.
PM to keep the rumor mill, because when people do not know, they will make up, right? They always, and again, being flexible, pivoting as needed, and reassessing. Always
How did you get people's buy-in into that? Because, you know, those all make complete sense, right? So
Well,
when
like,
people are balancing their own health and the health and lives of their families.
I have individual meetings with folks who were, a lot of people said, okay. And then some people who were like, I'm not sure about this. I had individual meetings with folks who were more reticent. How do we bring you along on this journey who's asking, what needs do you have? What do we need to do? For some, our medical providers meant, okay, you will not do COVID testing. Because I had a doctor who had an 80-year-old mom, and she said, yeah, I would prefer not to do COVID testing because, like she said, if I bring COVID to my mom, she will die.
And that was before the vaccine, right?
Yeah, oh, way before the vaccine. We were talking March, April, May of last year. So I said, okay, we'll keep you, the rest of us will do the testing, and you will be. So that's what this is where I mean about flexibility, not making just everybody has to do this, everybody has to do that. And that kept us moving. That kept us going as we are and looking at our staff in ways that are not as, yes, with one mission. And that's what the other thing I like to point out is that the mission was a North Star. Oh, right? Yeah. The mission as a North Star is what guides us through these rough waters. Sometimes I felt we were like a rescue ship, and our patients were at the center of the storm.
That's powerful imagery.
And we only had our mission as our as our guiding star, and we were there. And I'm sorry, I get a little emotional about this, but
Yeah, of
we
course.
had some tough times, tough days. I remember, when the numbers were here in Los Angeles, where
Mm.
we were like an epicenter of COVID cases. And this is, of course, before the vaccine. And we had so many cases, so much of that. And we had a lot of work to do. And just tremendous amount of testing they were doing. We were doing hundreds of cases testing. And the staff moved forward, and they were able to accommodate. I remember one thing that happened that I find interesting, I will say. Our neighbors in our building where we have one of our clinics complained that we were doing testing. So we were able to get a mobile clinic to move testing to a parking lot of a school that is closed because
Wow.
schools are closed.
Right.
And we were able then to do more testing
Oh,
because now we have being outside, we were able to do way more testing that we could do in our clinic. So even that flexibility, being able to pivot to a mobile clinic, gave us that opportunity to do even more. So just keeping that open mind, that learning mind, gave us an opportunity to do more when in those days do that. And then a lot of our patients, when testing was going on in large scales, are not able to go on a website to sign up for back there for testing. So they
right, because there's
needed to just
access
show up.
issues, right? There's
Access
access issues.
issues, language, so they needed to just show up to get tested. And the same thing is happening with vaccines now, like going to a website to sign up for a vaccine appointment. They're not able because of their lack of internet knowledge. So they need a place they can just show up, and they don't have language barriers or cultural barriers. So that's where we come in and we provide that access. Now
And so
that
that
things
was the
have changed.
30% that you were referring to of people that were still coming in.
Well, now with the vaccine,
Ah.
again, pivoting, being flexible and pivoting. Now with vaccines, we're doing less. Probably we're down to 50% of our visits, or even maybe less, maybe down to 45% of our visits are down in telemedicine. A lot less of our visits are in telemedicine. So we have being able to bring a lot more of our patients, and we need them to come in. We have other things that we have to do. We have to do preventive health services like pap smears or immunizations, things that we cannot do remotely. They have to come in, and so
Of course, yeah.
it is a good thing that now we are vaccinating. People are coming in. We have done so far probably like 8,000 vaccines in the local area, and so that's a really good thing that we have
That's a
been
really
very
good thing.
active in
So
vaccinating.
just to kind of summarize, it sounds like what you're saying is you've used your kind of mantra of flexibility, pivoting, and reassessing, to just deal with the moment that you were
Yes.
in. And every day the moments kept changing, circumstances kept changing. And I've also
Mhm.
heard you say in the past when we've spoken, never lose the opportunity that a crisis provides. And it sounds like you
Yes,
did
that is
that,
correct.
right, with your telemedicine, as well as with your parking lot clinic.
Yes, that's one of the things that I always like to remember. Never lose a crisis. one of the other things that happened is, as I said, the pandemic was a pressure cooker. And there were things that they were coming. There were, for example, the access to hospital records electronically. And we call it health information exchange. And that was coming probably the next 2 years. And we started to do that probably the next month after March. So now we do that regularly. We have access to hospital records electronically all the time. Previously, we were waiting for our patients to get their own records or get it through the mail, get it through fax. And
Wow.
we jump into that opportunity because patients were not coming in. Now we do electronic exchange of records with hospitals regularly. That was an opportunity that crisis completely forced us.
So so just to connect the dots then, so you've really adjusted the way that you deliver healthcare, in that you've added, right? You haven't taken away, you've added.
Yes.
By, with the digital transformation. How has that impacted your patients, and how has that impacted your employees?
Well, for one thing, we have improved care.
Oh.
We have definitely improved care because
Wow.
now we have more access. Just last Monday at our board meeting, I did a review of the last 13 months with my board. What the lessons learned in telehealth, and how now through telemedicine, which, as I said, is going down. We needed to. We cannot be like what it used to be, but we have more access. I have patients who they make appointments while they're taking a break from work. So they don't have, they don't have to take a half a day to come to the doctor and wait in the waiting room. Or they're in a park with their kids while they take a call from their doctor. And just to review lab results or to get that is perfectly a way to increase access. Now, many times we do need them to come in to do a blood pressure check, or like I said, to do immunizations, or to do a preventive health service, whatever that is, that we need to lay hands on a patient.
Sure.
So it has to be a combination of both, but telemedicine gives us more choices, it gives more patient choices. And I think it's a good thing that the pandemic, from not doing zero telemedicine back in March to now doing probably half our visits.
That's really, I mean, congrats, and
yeah.
and what a gift to a community that I mean, it suffers in general because of it's an underserved community, and being in the center of LA, which followed New York as, being among the worst last year, and now, it's just gotten easier for them. And it sounds like as time will go on, it will continue to get easier. I would love to talk about you and your employees just as humans, right? Going through all of this, tell me the story about people's resilience, versus their stress, people's, North Star versus, their burnout. So can you tell me that story, going back for yourself and your team?
Like I said, it was tough. I think we depended a lot on each other, that we knew we have each other's back. And by keeping open communication, by relying on each other, and we created a little video just kind of to celebrate what we did together. But it was, yeah, of course it's a labor of love, but it was more than that. It was a labor of family. That I want to emphasize, yes, love, of course, but family in the sense of being together. and knowing that even in the hard times, we will, even when we make mistake, we assume best intent. And that we had open communication. Like I said, when that doctor said, I don't want to do tests, you know, she knew that we could talk about it. And it was because of her mom. It wasn't because she was a bad doctor or that she was a mean person to others. It was because she had there was something else going on, and it was about her mom.
Back then, yeah, that would have been a death sentence, for
Right.
her elderly mom. Yeah.
And then originally when I heard about it, other people might have believed, oh, she's just, she's this or she's that, or why does she want to work? But there was a real reason, and other people needed to know. And openness was
Were people
better.
supportive, or were they resentful that she got
But
an
the fact that
exception?
we were open about it, there was no, like there were open secrets that
Open secrets.
that instead of keeping it as a oh, she's not doing that. And of course she allowed me to say it, by the way. This is not a she allowed me to say the reason, because it was not but to share it, but with it, that would not be. But what I'm trying to tell you is that that kind of opportunity to share each other allows us to move forward. That takes time, by the way, to do
Yes, it
that.
does.
But,
And kind of in between the time, and you even referred to this yourself earlier, there were times when you would go home after 10, 12-hour days and with emotional and physical exhaustion and asking, how am I going to keep going? How did you all keep going?
how did we all keep going? We, I guess our commitment, how did we all keep going? We were kind to each other, I think. Kindness, gratitude, and also allowing the sense of community that we have, and a sense of mission, that we're doing this for. Now, personally, you asked me to talk about me personally. I think that, of course, my family was very important to me. And like I told you, some days I thought, I don't know how I'm going to do this again.
Yeah.
And then I got up the next morning, I went to work, because throughout the pandemic, I never stopped going to my clinic. And I think that it was just that sense of commitment that I kept going. And that's, of course, the usual stuff that I tell to my patients, by the way. I always tell my patients that the basis of a good life are a good diet, exercise, and sleep. So even through the pandemic, I tried to maintain that. So even as a doctor, let me tell you, everybody who's listening, excuse me, who's listening, is that. So, but anyways, that's what we did. Now we're in a different stage. Now we're in the vaccination stage. There is a light at the end of the tunnel. There's air. I feel air in the air. We can breathe and we feel better.
Yeah. And so how is everybody doing? Right. I mean, you've just been through, through war, right? You've been through a crisis, and
Yes.
under your leadership, you kept everybody together. You kept everybody focused on the North Star. You took care of the human element in both your employees as well as your patients. and you adjusted the business model, right? And your operations to do these things differently, to adapt and to transform to the moment. So how is everybody doing now that you've kind of gone through that, what had to have been traumatic for some people, right? So how is everybody doing today?
Well, now most of our employees are vaccinated. We are in a whole different stage. We are vaccinating thousands of people. We have vaccinated thousands of people. We're vaccinating hundreds of people now in different places around LA. And there is a different sense around the place. Of course, we don't have the sense of emergency we had. We don't see the number of COVID cases. There's a sense of hope in the air that we did not have before. And now we're in the middle of spring and things are looking hopeful.
Yeah.
We're looking forward. Actually, we have a general staff meeting. And for the first time, we talked about having an in-person meeting. And the only reason we did not have it in person is because our big staff room is full of vaccine boxes.
Oh.
And we could not move them. We had no, decided to have again a meeting. We had no place to move all those vaccine boxes somewhere else. So otherwise we could have had a in-person meeting.
Yeah.
Back to normality. So we're looking for ways to move back to normality, back to the way it used to be. So little by little, we're going to start opening back.
That's wonderful. That's really wonderful. So really under your leadership, this very, very critically important healthcare service for the Los Angeles community, not only weathered the storm, but came out stronger.
I think so.
So real tribute to you, Felix. Thank you for sharing that story.
To look back.
Yeah.
To reassess. Many times, as leaders, we don't have the opportunity. We just gotta keep going, and this being with you and the opportunity to look back and to reassess the whole year, it's really important. Thank you.
Yes, thank you. So I always like to ask my guests these last two questions. So what are, from a leadership perspective, right, as the Chief Medical Officer at CSC Health, what are three what kind of leadership takeaways that from your experience in navigating, through the COVID-19 pandemic crisis?
Well, the first one is what I started with, my mantra, which is be flexible, pivot as needed, and reassess. So that guided me through, because I always felt that during the worst days of the pandemic, that kept me moving in a way that it was important and it was necessary to be able to look at the problems, to be flexible, to pivot as needed, and to continue to reassess. Okay, so we're doing this today. Do we need to change? Do we need to move forward? And to continue to do that. The next one, of course, is to not waste an opportunity, a crisis, excuse me. Do not waste a crisis. This is a crisis. What else can we do here? Important things, things that were coming in the future, like telemedicine or the health information exchange, to have access to medical records from hospitals. That was coming in the future. And that was all implemented in a matter of weeks.
Amazing.
So crisis brings amazing opportunities. So use it as much as possible. And the last one will be the mission through the rough waters, through the rough times, must continue to be your North Star.
Mm.
That's your staff, your group, your team knows this is where we're going. Because there will be times that, you know, it gets, you know, it is dark.
Mm.
And the mission is where we'll keep you grounded. You know, we were like, you know, tossed around, and we needed to be secure that it was for our patients. We were doing all of this stuff. So the mission, and that was something that we needed to bring back often. This is what we're doing this. And that kept people grounded.
I
So
love how
those
you
would
said
be
that
my
that was
3
grounding.
takeaways.
When
Yes.
you went home and you talked to your family, your wife, your loved ones, and you said, I don't know how I'm going to get through this. What support did you get? Why don't we end with that?
Okay. What support did I get? Um, you know, I guess the support that I get from my family was, you have done this before.
Mm.
You have, sometimes we might be our worst critics, but our loved ones see the best of us,
Oh, yeah.
right? They see when we sometimes say, oh my God, I really messed up. Our loved ones can see, oh, but you went to residency. This is nothing. You used to work 120 hours. And you're like, oh, you're right. I did that. And
That's right.
and and even though you're thinking, oh my God, they cannot do this, they can remember, because you're living in the moment and you're thinking, oh no, this is impossible. They see the best of you in the moment that you're thinking the worst of you.
Yes,
See,
yes,
you're thinking the worst of you because you're the worst critic,
yes,
and they think the best of you. And
yes.
that is the reason you should always have a support system. That support system
Mhm.
allows you completely help you in reassess some of that negative thinking that we all have, right?
Sure.
Because you know, a part of our brain is always, and we all should have something that's critical and says, are you doing the right thing, or is this the wrong path?
Yeah, and
But
you're also a
sometimes
high
that negative
achiever, right?
thinking, huh? What is that?
You're a high achiever.
Yeah,
So,
and then
you have high standards for yourself and you're also grounded by that North Star, right? By that
yes,
mission.
and but sometimes it can overwhelm you.
Yeah.
Sometimes it can like go overboard.
Mhm.
But your support system, your support persons see the best in you, and they will be like, you can do this, and you're like, yeah, you're right, I can. They remind you that, and I think that's that's the important part, and they play a tremendous role. So that, I think that's what they always
Yes.
did for
So it's
me.
a nice way to kind of end with, we could, because we started talking about, this at an organizational and leadership level, and it's also important to, have and appreciate loved ones, and families can be anything, right? It can be the standard nuclear family, it can be friends, it
Yeah,
could
of
be,
course.
whoever loves you. It could be one, it
Yes,
could be many. That people do have within work, right? The team orientation and the collaboration that you fostered, as well as outside of work, that
correct.
extra emotional booster, when we're feeling like we're falling, and people will be that safety net and help bounce us
That
back
is
up.
correct.
Yeah, yeah. Thank you so much, Felix. Dr. Aguilar, your wisdom and navigating through COVID last year, I'm sure saved thousands of lives.
You're very kind. Thank you.
I'm certain of it. and and you gave people purpose and you gave them direction, and there's a lot of importance and meaning to that. So thank you very much. For those of you who would
Thank
like
you,
to
Sue.
contact Dr. Aguilar, would you mind letting people know your email or your LinkedIn, how people might reach out to you?
My email is my first name, Felix.Aguilar, Aguilar, at post.harvard.edu.
Thank you. And you are on LinkedIn as well.
Yes.
Thank you, Felix. Thank you for listening
Thank you all.
to
Thank
the
you, Stu.
audience. And this has been Tapping Wisdom. Thank you very much.